20 years from now, NCCN is going to look a lot different. That's what I think. The membership of NCCN currently was built upon doctors, oncologists, others who treat patients as physicians. But I think we're going to realize 20 years from now that the team approach is going to be much more important in cancer, and these team members need to be involved in research, in quality measurement, in evidence development, the clinical practice guidelines, and so forth. So the membership, I think, is going to look a lot more diversified than nurse oncologists, social workers, all the kinds of therapists that you need to make this work, even people that provide financial advice. So a different membership, I think. Second thing is that we are going to realize, for financial and epidemiological reasons, that we need to spend a lot more time focusing on cancer prevention. So, of course, by nature, you'd expect that when NCCN was formed, we were really most involved in looking at therapies, diagnosis and treatment, because there was a lot of cancer to diagnose and treat. But from a societal standpoint, there'll be much greater value placed on prevention, and I think NCCN is going to be more oriented toward that. I think the third way in which it's going to change is more patient involvement, much more than we see now. Already, for good reasons, NCCN has patient representation, a lot of its guideline panels, but you're going to see patients much more suffused throughout the organization on the guidelines, in quality measurement, in data collection. Patients will have a greater voice and higher participation in NCCN activities as well. The fourth major change has to do with data. We've talked a lot about real-world evidence at this conference, and in 20 years, data will be coming in real-time, full stream. And there'll be a constant iterative loop of data input, updating guidelines and pathways and so forth. It won't be wait for a study to be developed and so forth. It won't be wait for traditional clinical trials. We will have different sorts of clinical trials, different designs and so forth, but real-world streaming data on a constant basis and updating any of the documents, guidelines, and other types of things that NCCN produces, that will be going on in a much more rapid turnaround fashion. So I think that's what it'll look like in 20 years.